Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome practicing OB-GYN and certified Pilates instructor, Dr. Lara Williams. Dr. Williams works in partnership with women to promote physical and emotional health through nutrition, exercise, and medicine through the exploration of both traditional and alternative routes.
Well, thank you so much for joining us today, Dr. Williams. It's a pleasure to have you.
Thank you.
So I know that you practice OB-GYN, but you're also an integrative physician. Why don't we go back and first talk about what sparked your interest in going to study medicine?
It was really interesting. So I remember in the 1970s, so I was a kid in the 70s, and the movie Grease came out. And my parents took me to a drive-in movie theater, and I still remember this. And I told them to wake me up if there were any doctor scenes. And I was probably 4, and my mom knew from an early age that I was going to be a doctor. And I didn't quite, I was kind of debating between medicine and law, and I wasn't quite sure. And my father is a PhD geophysicist, and so he wanted to know why I wanted to be a fake doctor. And because growing up, an MD for him was quasi-science. Wow. Why didn't I want to go into real science? And then when I went to college, being pre-med, I needed to get a certain number of courses out of the way, and so I was like, I'm just going to enroll in this track, and I can always change my mind later. And I never changed my mind. And so,
what'd your dad say?
It was really interesting because when I graduated from medical school, I was really like, okay, how's he going to do? And he just gave me the biggest hug and told me how proud he was. And I was like, okay, so I'm accepted. I'll give him advice and he'll be like, oh, that's great. And then he'll read an article and he's like, I read this great article. And I'm like, you mean what I just told you? So
that probably doesn't even have anything to do with his PhD. It just has to do with the MALE.
Yeah, I think there's some of that too.
So what then sparked your interest in going into OB-GYN?
Well, I went to medical school with the intense purpose of not going into OB-GYN. It was the last thing on the planet I was going to do. I was like, who would do that? That's disgusting. And then my first rotation was, I know what happened. So my first year, Texas had this program where they were trying to get more primary care providers. And so my aunt was a labor and delivery nurse, and she worked with this amazing doctor, Dr. McNew, Lamar McNew, in College Station, Texas. And he was family medicine, and this was before the hospitals had integrated. So Medicaid was still divided out. So private hospitals took private insurance, and then he took a ton of Medicaid. And she said, you need to go rotate with him. And I was like, oh, okay. And so I got $500, which didn't even cover my rent, to spend the summer, so 1 month with him. That was my reimbursement. And I remember delivering my first baby with him and thinking, uh-oh, I have a problem. And I continued to work with him, and I was like, okay, it's probably just a phase. And then my next rotation was pediatrics, which is what I thought I was going to go into. And that professor looked at me and he said, you've gone to the dark side. And I said, I have not. He's like, you're going to be an OB. And I was like, I am not.
What led him to say that?
He just watched my talking about the rotation and me diving into what the moms were telling me about their story instead of about the babies. And yeah, I was interested in the babies, but I was much more interested. And he said, you've so gone over. And then I kept having these great mentors. I worked with Charles Sanders, who I came back to College Station because where I went to med school, it was a split campus. So I was in Temple, and I went back with him and stayed with my aunt again, and he was just amazing. And he so encouraged me, and he said, you want a job? I'll give you a job. And I was like, I'm not sure I want to live in College Station, but it was just having somebody have that much faith and belief in what I could do was amazing. And so I just continued on that path, and I haven't looked back.
So you practiced traditional OB-GYN for how many years?
I have been 17 years out of medical school, 18 years out of medical school.
Okay. And at what point did you start transitioning your practice, and why to an integrative practice?
My third year of residency, I had a hand injury. So one of my professors was like, try this needle driver. And I've sewn my whole life. Like, I do counted cross stitch. Most of the professors will know me. I'm sitting in the back sewing because it's so tactile. I'm such a kinesthetic learner that I found that by sewing, I can actually learn this material better. And so I had an injury, and then I got it on the other side. And so, being the good little doctor that I was, I went to see an orthopedic surgeon. He's like, well, I can open your wrists. And I'm like, yeah, that's not happening. Here I am, surgeon. I'm not even done with my training. I'm getting paid nothing. And he gave me a steroid injection. I had a terrible reaction. So he thought it was the bottle. He threw the bottle away because my arm got bright red. And so he injected the other side, and I threw this bottle away, I tried something else, same reaction. And I was like, okay, so traditional's not working. So he's like, take non-steroidals. I started having I started getting gastric reflux. I'm like, okay, not working. And so I went to see an occupational therapist, and she was like, you need different instruments. And I said, I'm a vaginal surgeon, and there's only so many things that are going to fit there. And she tried something else, and nothing worked. And I happened to be doing Pilates at the time. And my Pilates instructor happened to be sharing a space with a massage therapist who also did Aston patterning work. So she started working on me, and she started teaching me how to move my body differently. And I was like, okay, and I started getting some improvement. And then she's like, I'm going to send you to this woman who does something kind of different. It's called craniosacral therapy. And so I saw her, and the first treatment she had, like, it looks like woo-woo. Like, she puts her hands on me, and I'm like, I just spent how much doing this? And my parents had said that they would help, but I had a medical claim through work because I truly had an injury. So I got a lot of this, thank God, covered through workman's comp, because there's no way as a resident I could have afforded this. And my first session with her, I was like, this, and I walked out. My arm was on fire. I was mad as a hatter. Like, my temper was like flared beyond anything, and I had to go back to work. And I was like, I have to get out of here as quickly as possible before I say something, because my filter was gone. And I was like, what did she do to me? And then I started getting better. And
at what? How long?
It took a little bit, like, because this was a chronic injury at this point, like, because I was still operating, I was still being a resident, and then I started getting into gyrotonics, which is a movement therapy that looks a lot like Pilates, but is much more circular. And so I was like, okay, Pilates really helped me. So I started becoming a Pilates instructor. And then I was like, okay, that really was helpful, but I'm still missing something. So I became a gyrotonics instructor. And I happened to get lucky and moved to Oregon, where there is one master trainer in the state. And I happened, for my Pilates, get referred to her, and I delivered both of her kids. Like, we have a long-standing friendship. I consider her a great friend and confidant. And I still work out with her to this day. I saw her on Tuesday. And then I was like, okay, well, that was great. And I thought that was the piece that I needed, but I still didn't. So then I started doing acupuncture training. And so meanwhile, my Pilates and gyro, I'm able to have conversations with people like, okay, let's not do planks while we're pregnant so that we separate our rectus diastasis. And, oh, I think you're having a psoas injury. And it wasn't anything I learned in medicine. It was like all this fitness stuff. And people started being like, oh, she actually knows what she's talking about, and she can actually have a conversation with us. So then I did the acupuncture training, and I had just had our first child, and I had this great acupuncture training, and my son was born prematurely. Here I am, like, thinking I'm doing everything correct. My water breaks walking out of the work at 33 and 6 weeks. Wow. I get stuck in the hospital, and I'd already been doing acupuncture in my own body, and I had done the elimination diet, and I was seeing a naturopath, and I really credit her and acupuncture. I had zero problems getting pregnant because I had been preparing for 5 years. Like, we'd done all of these things, and I was 36 when I got pregnant. And our son was born prematurely, and he got a, like, inside of his ears rash, eyelid rash. Like, I'm looking at this poor, miserable child who is colicky and miserable, and I took him to the doctor, and they're like, it's acne. And I was like, no, it's not. So I took him to the dermatologist. She's like, it's seborrheic dermatitis. And I'm like, she's like, just give him steroids. And I'm like, yeah, that's not happening. And so I put myself on an anti-inflammatory diet, and I got him to heal. And then we figured out there were some other things, like we called it my poisoned milk. He couldn't take strawberries. I was not allergic to them, but he absolutely could not have anything with strawberries in it. And so then I started being like, okay, there's something here. And then while I was doing my acupuncture training, and he'd come with me because I was breastfeeding, and my sister would stay with him so that I could do the course. One of the instructors there was a homeopathy instructor as well. She was pediatrics, taught acupuncture and homeopathy. It was like perfect. So I started doing some homeopathy training. Meanwhile, each piece I'm just bringing back in. I'm doing acupuncture on my patients, starting to give homeopathy, really talking about elimination diet, really starting to look at what their lifestyle looks like, stress management. So I'm just kind of incorporating as I go. And then without even meaning to, like, it was just kind of like the medicine I wanted to receive. And so I started going along on my journey, and then she was, I remember sitting in her lecture, and she's like, yeah, my sister just did A4M. And she's like, they really know their hormones. And she said, and I know a lot of people who also are doing IFM. So me being who I am, I enrolled in both. I started with A4M with their hormone module. I went to the advanced course, and then I started doing IFM, and then I've just enrolled in the master's through George Washington. Because what I realized, and at each juncture I've pulled some more stuff in, I'm also doing another homeopathy class, is because I didn't want to hear one person's perspective. I wanted to hear multiple, because I teach now, and I teach everything from naturopathic students, residents, PA students, nurse practitioner students, MD residents. One of the things that I realized is so many of them have heard one perspective, and then they incorporate it into how they're practicing, and they don't hear all the other perspectives. And I think sometimes when you have a little piece of each, you can be like, okay, I buy that, I'm ignoring that makes sense, I'm skipping that. So you start getting a little more discerning, because what I learned as a surgeon is you can read a paper, and if only one person has done the surgery, I'm not going to get the same results they are. It's not going to work. I need to figure out what works in my hands and in my practice and with my brain. And so having all of these different modalities has been amazing, just to kind of figure out, like, how do I want to practice? What kind of patients do I want to take care of? And it's just kind of gone from there. And I'm really enjoying the journey.
Are you a solo practitioner?
No, I'm in a group practice. So I'm the managing partner of, I work for a multi-specialty company that is all physician owned. And then each division, like we have plastic surgery and GI, and there's 2 OB divisions, and I'm the managing partner for my division, and I have 5 partners and 2 nurse practitioners.
So are you the only one that practices an integrative approach?
No, actually one of my other partners was doing it even before. So she got her background in nutrition, and so she'd always been doing nutrition, and she was doing bioidentical hormones in front of other people, and so she's been great, because now she's learning from me. So at first I was learning from her, and now she's kind of coming in and being like, okay, what do we do about this? And what do you think about this? And she'll send me texts like while I'm at these conferences, and she'll be like, I know you're there, so can you find out my question on? And which is really fun.
So as an OB-GYN, other than the obvious pregnant patient,
Right.
Who would be your typical patient? And why do they come to see you?
Well, I'm seeing a lot of infertility, folks that don't want to spend the $20,000 on IVF, or who just don't kind of feel like that's the direction they want to go. A lot of polycystic ovarian syndrome, endometriosis, fibroids, heavy periods, folks that are like, I don't want to have a surgery. I don't want to, I want you to work with my naturopath, because that's where a lot of them, they're seeing a naturopath, they get a lot of referrals from naturopaths, because they want me to work with their naturopath, which I'm fine doing. And they want somebody who's willing to look at them besides, like, here's some birth control pills, or here's a surgery. I still do those. I think that there's a time and place for everything. But it's nice to have another bag of tricks.
So what are some of the modalities that you implement?
I always start with, like, the basics. Like, some of my favorite success stories are just modifying somebody's diet, like just getting them to, like, sleep and eat. You know, I was just listening to Jill Carnahan, and she's talking about clean air, clean water, and clean food. And I would also put like, and 8 hours of sleep. So sometimes it's just simple like that. I still use acupuncture in my practice pretty regularly. I use homeopathy. And then supplements for sure, vitamins, meditation. Like I'm teaching a bunch of group classes now, and I have one on stress management. We're talking about heart rate variability, and we're talking about meditation. And I've got the stress adult coloring books. Like, so people, because a lot of people won't try something unless you put it directly in front of them. And that's what I'm trying to do with some of the group classes, is give people the ability to sit in a room with other people who are, so that everyone learns from each other. I'm in an all-female business, and one of the things that I notice is that women tend to vibe off of each other. You know, like, what's your sister doing? What's your mother doing? Like, what's your friend doing? And so I tried to use that power. And I also believe that women are the center. Like, I love my husband, I love my son, but I really believe that we forget how much power women have to make change. Because if you change one woman, you don't change one woman. You change her mother, her sister, her daughter, her friends, her in-laws, because they all start listening to, what are you doing over there? You know, you look better, your skin looks great, like, you're having a ton of energy. Oh, you got pregnant at 42, like, what's your secret? And women, they don't shut up, which is one of the things I love about them. Like, they'll keep being like, oh no, you've got to do this, like, and they keep coming back to you. So that was part of and I think that's my other love for women's health, is I don't want to take care of males. I want to take care of the population that I love and really work in a preventative setting.
So the other OB-GYNs in your community, have you received any criticism for how you practice?
I always start off when I see patients like, I'm a little different than the average. So, and I always tell my patients, especially new patients, like, okay, this is kind of where we're at. I think where I'm at currently, I'm at a pretty cool hospital that's got midwives, and so it's a little bit more integrative just in general, and I think Portland in general is that way. But I'm not seeing anyone else. Like, there's a couple that are starting to reach out, but not doing obstetrics, because I think it's really hard to do this while you're still doing the sleep deprivation of obstetrics. But I didn't want to give up obstetrics because I feel like that population, there aren't people who can weigh in, because when you're in obstetrics, like the liability and everything else, like most people just kind of, I'll just hand that off to your OB and then you come back when you're done. And I feel like that's a really vulnerable place, is pregnancy and breastfeeding, and then of course preconception. So I haven't necessarily received criticism, but you don't, I'm not getting a lot of people send, like occasionally I get somebody who sends somebody over, but it's usually because they feel like they're crazy and they're just like dumping them on me. And in most cases I'm like, oh, this is perfect for me. Like, this is a great patient.
So you have a unique attribute on your resume in that you have studied both with IFM and with A4M. So what would you say would be the major differences between the two organizations?
I started with A4M. So my first journey was A4M. And what I noticed about them was I had immediate, like, practical applications that I could use. Like, they really do say, okay, what are you going to do on Monday morning? And they dive into a lot of the testing and supplements, which for me was super helpful because I've got people coming in on all of those because I'm in a very saturated naturopathic community. So I'm getting all of those. So that was really helpful for me. IFM, their first introduction is their basic course, which is really grounding the physician. Like, it was talking about self-care for the physician and how to take a history and really looking at medicine differently. And I kind of felt like I was already doing some of that. So, but there's some great tools there. They have an amazing toolkit. And then their modules are very much more centered around that. Like, I feel like they're more centered around if you're going to go into primary care. And most of their practitioners are internal medicine, family medicine, like very primary care based. They have amazing diet, lifestyle, like tools that, you know, I still use regularly. My impetus for doing group classes actually came from one of their instructors who was like, I did this out of necessity, and I was like, huh. So it's been really nice to have the merge of both, because I feel like I've been able to take from IFM like the foundations, and for A4M I've been able to take, like, A4M spends a lot more time talking about how are you going to actually manage this patient? What are you going to do if this arises? And a lot more specifics, which for my brain, especially as a specialist, is very helpful.
With the science to back everything up.
Correct. Oh yeah, no, that's what I liked about both of them, is I've been to other places and received other training, and I actually stopped going to one of them because I was like, okay, so I see you've put all the journal articles up, and I went home and pulled the studies, and I was like, that's not what any of them say. Like, it was really interesting to have such distrust, and because again, I always go after multiple sources because I wanted to hear what every kind of group is doing. And especially I think as an OB-GYN in such a high liability field, I'm very careful and cautious, and I kind of want to be Pam Smith when I grow up. You know, just her elegance, her grace, but more importantly, her confidence and her knowledge. Like, I remember being at the hormone module, and I had asked her a question about a patient who had elevated testosterone. And she said, have you checked her blood sugar? And it was just like, and then we're 2 speakers later, somebody's talking about, oh, just keep cranking their testosterone. And she walks in from the back of the room, and she just says, how about their blood sugar? And I was like, that's awesome. Like, she just completely walked up with utter confidence in what she does and called out somebody who's on stage for something else. And I kept thinking, that's my kind of woman. Like, that's what she breeds. Like, I've listened to her speak multiple times, and it's the conservative, and I really admire and respect, like, okay, here's how you're gonna stay out of trouble and still have amazing impact on your patients. And I love listening to, like, you listen to Lara Williams, you know, her knowledge of dietary stuff, you're like, it just jaw drops. And she's so versed and confident, and it's just, it's amazing to see so much of the background of the speakers and where they're coming from and their knowledge base and their levels of expertise. But you mentioned science, and that's what I love. It's like, here's the study. Like, it's not because I said so. Like, this is what I'm doing, but here's the knowledge. And so that you can go and be like, all right, I need to pull that article. So it's been amazing.
So in addition to the stories that you shared in regard to the fertility patient or what have you, what has been, can you share with us a success story from a patient that you were seeing while pregnant, that perhaps when you started to see them for just as a general gynecologist afterwards, an impact that you may have had with that for them to have an effect on them both while they're pregnant and then post-pregnancy, something that they're taking with them, their toolkit that they've taken with them now as a new mom?
I think a lot of the women that I've seen that has the biggest impact are people who were in the same boat I was. So they come to me, they're postpartum, and their kid has a terrible rash, and they're beside themselves because their kid is miserable. Like, I actually delivered one of those just really recently, and I sent her, because she wound up with a C-section, the kid would not budge. Like, this kid, she did absolutely everything, like, just amazingly strong, brave, brilliant woman. And this kid just crossed his little arms and said, I am not going anywhere. And so I sent her to craniosacral work, and the kid had this terrible rash, and the craniosacral therapist remembered my story, even though this is my patient, but she still remembered my story. And she was like, isn't there something we can do here? And I was like, yes. And so she's like, can you send me the elimination diet? I was like, attached it as a file and sent it forward, and she shared it with her. And I think that those are the things, is like, this woman came back to see me, and in labor I was doing body work on her, and I had this overwhelming gut feeling that something was going to be happening with her baby. And it woke me up a couple of days beforehand, and I've learned if I'm grounded, my intuition is dead on. And so I said, I need to see you back in 2 days. And she came back in 2 days, and the kid had a flat heart rate tracing, and it was concerning. And I delivered right as the blood gases were starting to go down, and the baby was starting to become acidotic, and I knew that I had to watch this baby. And so I watched this baby like a hawk, but I could never tell the mom, like, your kid's been waking me up for 5 days now because I'm so worried something is going to happen to your baby. And I think that this medicine there are more people who have those stories where they're not, because I think medical school does a really great job of kind of drowning that out. And I remember I was an intern I had to do the ICU rotations, and this nephrologist came up to me completely out of nowhere, and he looked at me and he goes, "Hi," and I was like, "Hello," and he's like, "I think you might be a medical empath," and I was like, "Excuse me?" He's like, "So I'm a medical empath," and he explained his story. He said, without seeing the patient, I'd be on the other side of the curtain and I'd be able to figure out what was going on with them. And I was like, okay, I can't do that. And he said, I really encourage you to not lose this skill, and I really encourage you to figure out what it is, and I really encourage you to develop it. And it was the first time, because I did school in Texas, like nobody talked about empathy or intuition. And I could think back to if I had thought of a test and I didn't order it because my rational brain overruled me, I always regretted it. And so I kind of continued to work with that. And I notice if I'm not grounded, I call it the wrong church, right pew versus the right church, wrong pew. It's a whole lot easier to get close to where you need to be if you're just a pew off, but if you're in the wrong congregation, you're not going to help your patient. And so I find that if I'm grounded, I can really be like, I know exactly where I need to be. I'm within inches of where I need to be to find their problem. But if I'm not taking care of myself, I'm completely off. And so part of this journey was not only for myself, but my sister had been struggling with infertility for 4 years. And she'd done as far as she was willing to go. She was not going to do IVF, like absolutely not. And I said, okay. And so she had several surgeries, and it was frustrating to watch and her OB-GYN is awesome. Like, I did medical school with her. She's really talented. And she sent her to an amazing reproductive endocrinologist, and he did amazing things. But she still wasn't getting pregnant. And finally I was like, hi, I think you need to do some functional medicine. And her and I had started talking, and I said, why don't you just go see a integrative medicine practitioner?
She's in Texas?
She's in Texas. And I said, and maybe you could bring your husband along. Like, maybe we can get him there too, because I felt like both of them needed something to change. And so the integrative medicine practitioner put her on Whole30, and because she's dairy intolerant, was still having dairy, did some supplements, and of course I'm like, okay, let's not do that one, let's do this one, and it was like, they put her on licorice. I'm like, you can't be on licorice, you have hypertension, so let's take that one off, let's move this. So I knew, because I doubled down, I think, and doing both courses because I wanted to come up with a solution for her, because I really felt like, not recognizing at the time.
She was your inspiration.
She was. So she went through all of this, and then my body started changing with her. So she was getting shorter periods, and then I started getting, and I was like, this is really not fair. And I kept trying different things on myself, and then finally I found what she needed, which was trace tree berry. I put her on it, put myself on it, my period regulated, and she called me and said, literally 2 weeks later, I'm pregnant. And she's 23 weeks yesterday, and she's due in May.
How exciting.
Yes, and she's having her first little girl, and I really believe that this journey, if I hadn't gone on this journey, I wouldn't be having a niece.
So the baby will be named Chase?
She's having a girl, not quite. But it was, and I've had so many more stories like that. So because of her story, I'm getting routine patients. I think I had 2 while I was here that have got positive pregnancy tests. And they're like, should I continue on my trace tree berry? I'm like, yes, please. So it's just and I think that's what's so cool about this journey is you go to a conference, even if you walk away with just one pearl, that one pearl affects, 15 patients, and it changes their lives. And so because it's hard because you do your first course and you feel like, okay, I'm drinking out of a fire hydrant. Like, how am I supposed to have any of this stick? And then you take one thing, just one thing, and then that one thing tends to multiply. And then you go back and you're like, okay, I remember so-and-so gave a lecture. I'm going to relook at this lecture. And then you pull out your second thing. And I think sometimes we as physicians are so particular. Like, you want to be perfect. Everything has to be like, you have to know everything. And it's not going to work like that. It's starting to pull the pearls out and then taking one thing. Like, that chaste tree berry was one of those one things.
So your friend, her gynecologist from Texas, does she know how her patient got pregnant?
My sister has told her, because my sister, of course, smiled very sweetly as they're looking at her med list. And my friend knows me well enough to be like, okay, if Lara says that those are okay, you can stay on those. So I was like, well, that's good that she's not arguing with me. I appreciate that. Because I left her on some melatonin and I left her on the chaste tree berry until she was 10 weeks. And my sister is super conservative because she doesn't want anything to happen, because it's been such a journey. And yes, her OB-GYN was like, if Lara's doing this, I'm totally okay with that. And
yet you haven't been able to get her to cross over to the other side.
You know, it's hard. Texas is its own place, and I think it's especially hard for OB-GYNs because, you know, I always joke that the buck stops with the lady with the knife, and we have to see the stories that nobody else wants to know about. Like, I'm the holder of stories and sadness that nobody else wants to know about. And I think when you hold all of those stories, it's hard to start thinking, okay, how am I going to impact things? My journey got greater when I realized, okay, like, I have young children, and at some point I want to not have to be up all night taking call. What do I want to do when I grow up? And what I realized was, I don't want to be a hospitalist, I don't want to be a laborist, and I don't want to be a papologist. Like, I don't want to do pap smears all day long. And in my field, if you're not doing the whole care, you're doing one of those. And I didn't want to do either. And so I said, okay, I need to make a new lane. So I'm trying to create a new lane in my field where I can, you know, okay, maybe I don't do obstetrics where I do deliveries, but could I still see those patients in consultation with people who trust me to help their patients and navigate their med lists and stuff from somebody who understands both sides. So it's interesting and challenging and overwhelming, and, you know, I think sometimes my patients get frustrated because I'm running a little behind, and I'm like, I literally, a lot of times I'm like, oh, I didn't know we were going to talk about this today. Let me run out and grab these 3 things that I just learned about. And I always apologize, like, I'm running late, but I don't think they realize it's because a lot of times I'm like, the patient has appeared, because the joke is in my office that whatever I learned last weekend will show up all week in my office. And so a lot of times I'm like, let me hold on, let me pull it up. Like, I know it's on this slide, let me pull it up. And so my first week back, my medical assistant's always shaking her head. She's like, we're gonna run behind, because this whole week will be whatever you were just talking about. So I guess I'm gonna have a mitochondria week.
I was going to ask, what's on the list for next week?
Mitochondria.
Well, let's hope that your pregnant patients are doing okay with that. So
yes.
So what about teaching?
Teaching, I love teaching. Like, I've always loved teaching. Right now, I lecture to the residents. I have a naturopathic student who wants to do a residency with me, so she sought me out about a year ago, and she's been stalking me, and she's amazing. I have multiple naturopathic residents that are on my schedule right now. I have a PA student who is very interested in functional medicine, so I'll see her when I get back on Monday. I teach my partners, I teach class. We have a clinical meeting once a month, and I'm starting, like last month, I'm giving them a functional medicine, integrative medicine talk for 20 minutes every 4th Tuesday. So I don't know, like, do I think I'm gonna teach at some point? Yes. Have I figured out what setting that's gonna be in? No, not yet.
So you mentioned the term homeopathy. For those that don't know what that is, how have you incorporated that into your practice?
Homeopathy, well, first of all, when I first learned about homeopathy, I thought there was a great British sitcom where they were like, quick, Dr. Stat, Arnica, like 1K, and like, you know, ER kind of thing. And and that's what I used to think of homeopathy, like, okay, this is a joke. But I was watching this woman in the acupuncture course that I took who was obviously incredibly intelligent, incredibly persuasive, very knowledgeable, and she was dealing with a lot of medically fragile children with amazing results. And so I said, okay, what is she doing? So I started researching. I trained with CEDH first, and now I'm training with NASH, the New England School of Homeopathy. And CEDH is all geared toward physicians. Like, it is really going after the MD, NP, PA, DO. Like, that is who they want. All the instructors are MDs, DOs, and so they put their paper, just like A4M, you know, here's the study. And so once I started getting into that, you start looking at, okay, so I've got a lot of drugs that have a third, so placebo's 30%, right? So if you look at the good studies on placebo, it's 30%. And a lot of our drugs are not as good as placebo. And so you start looking at homeopathy, and I'm like, okay, great, it doesn't cause any harm. Because when you start realizing how it's made, you're like, even when the FDA starts going after belladonna, I'm like, it's fractional. Like, there's not enough in there. And like, granted, if it's manufactured correctly, et cetera, et cetera. But if you look at true manufacturing, like, it's 6C is 1 drop of the essence plus 100 drops taken out 6 times. So they do that process 6 times before you get down to a 6C. And you're like, there's nothing left by that point. But yet I use it with my kids. Like, I had a cough I could not get to go away. Like, I was up, I was coughing. I go get my homeopathic cough syrup. I take whatever the direction on the bottle is, and my cough is gone. And at that point in time, I didn't care. Like, I don't normally take anything. So, and then through cold and flu season, like, I would take oscillocosinem, and one of my partners had the flu really bad this year, and I was like taking it like crazy. And I still got my flu shot, but I took that. And so what I'm finding is I'm integrating it. So I use it, perfect example, on my C-section patients. So people who I know are gonna have a C-section, we started ahead of time. And especially people who are like, I don't wanna take narcotics. Like, I really don't wanna be on narcotics. I'm like, no problem. Let's hit you with a bunch of non-narcotic options. Or I have another wonderful patient who was having clogged ducts like nobody's business. And she was miserable. And I put her on Phytolacca, and she was like, you're a goddess, you're a genius. And I was like, oh, and she was like, no, you don't understand, like, everything's better. And so for me, so I continue to do training in it because I think there's a lot of really interesting history, just like with Chinese medicine. Like, are we gonna see 1 million studies? No, because it's got 3,000 years. And homeopathy is not far behind, especially in Europe, that it's part of the culture. In the US, not so much, but one of the most recent statistics I was reading is it is a billion-dollar industry now. And so I think if physicians don't start figuring out homeopathy, their patients are going to be more educated than they are, and that's never a good place to be. Like, you always want to be in front of the patients and learn from them. But it's been amazing. Like, the successes that I'm seeing with it are really, really cool.
So your father, the scientist. What now, all these years later that you've had your MD and you've integrated all of these incredible modalities and research and education, and that you've continued to better yourself and learn more, what's he tell you today?
Well, it's really interesting. Like, we still argue. Like, so he's a diabetic, and I've been all over his case about his diabetes because he carb loads, and it was really interesting. So I started talking to my mom about intermittent fasting because I went to one of these conferences and we were talking about intermittent fasting, and so I was telling her about it, and she mentioned it to him, and he kind of blew me off. But then there was an article published in one of the magazines he reads within the last month, and he's now doing intermittent fasting. He feels great. He's lost all this weight. I'm sure his blood sugar is going to be amazing. So I think he's more open than he would have been previously. And it was funny because he asked my mom to ask me if I was okay with it. And my mom's like, I think she's going to be fine. And so he's looking at more of those things. Like, is he going to start taking homeopathy? No. Does my mother? She does. So it's been cool to see how my mother, who grew up in Texas in a very traditional environment, has now started to incorporate in and see those same powerful results in her own life, which is it's really been wonderful.
So what's your 10-year plan?
Let's see, 10-year plan. Well, hopefully I'll pay off my mortgage. Because if we get our mortgage paid off in 10 years, then I can consider possibly not doing obstetrics anymore. I'll finish, I just have a little bit left with A4M. I've already passed both my boards. I'll finish IFM, I'll finish my master's, I'll finish the NESH program, and then I don't think I'm gonna do any other trainings, like big trainings for a while. It'll just be maintaining. I really want to figure out what patient populations that I want to narrow down to, because I think that it's really easy to promise everything to everybody, and I think at a certain point in time you have to narrow down and pick your lanes that you're really good at. At least that's how I work. Like, I can't be good at everything. I have to be good at, a few things that I'm really good at, and I think infertility is going to continue to be one of those. Part of it is it's answering my why questions. Like, one of my why questions is, why do women form endometrial polyps that annoy them? And I don't have a whole lot of options and answers. And so for me, it's going to be continuing to go after the questions that I have that my patients need help with. Like, where am I starting to see, like, I think I'm going to end up doing a lot more environmental stuff, because I can see that nobody's kind of looking at that lane in obstetrics. Like, how do you help these women who are environmentally burdened prior to getting pregnant be ready to get pregnant, so that you can influence future generations?
You should team up with Dr. Sinatra. The two of you can come up with something.
I think that's so. So I can see my next thing being more training in exactly what I was just listening to about environmental toxins, and how do you heal those people and identify those people, because a lot of those folks are, they're just having babies, they're in the middle of their careers, finances tend to be like on the tighter side. So how do you get them to make changes when everything's riding on things to stay exactly the same? Because I've been in that, where you're like, no, I don't have money on either side of this. I don't have the ability to get a new job. No, I don't have the ability to move out of my house. Like, I can't do any of that, but yet I want a baby. So how do I help support those in reality, like the reality of the situations?
So how would you impart some wisdom to a fellow physician who is frustrated with practicing traditional medicine, but yet too scared to go outside the box?
Well, I think how I kind of did it was you start picking something you love. Like, for me, it was acupuncture. Like, I'd already had personal experience with it, and I decided to get training there because I already knew it worked. I didn't need any convincing. Like, I already believed. I already drank the Kool-Aid. Like, I already got that. And you start with something, and then you start incorporating it. And that was, people were like, oh. Like, I would do a procedure and then do acupuncture, and they'd be like, I'm fine now. And I'm like, mm-hmm. And then once you start seeing that, you're like, okay, well, what's next? And then somebody will come in with something. It's allowing, especially if you're fearful, because I'm not a jump off the cliff kind of girl. Like, I am the primary income in my family. We are financially conservative. My husband teaches financial, knowledge and strategies and how to save and invest. And like, so I'm not the jump off the cliff girl, like, never have been. So I think that for those, because I am that girl, I didn't want to, you just start to convert, because what will happen is somebody will tell their friends, especially if you deal with women, they'll be like, hi, like, oh, I have the best doctor, she does acupuncture. And what started happening is I've done no advertising, like, I've done no anything to tell people that I'm doing all of these things, but yet they come in and know. And I'm like, because I always start with, like, let me tell you a little bit about myself. They're like, oh, that's why we picked you. And I'm like, how do you know? Oh, you see my girlfriend. Or, yeah, my naturopath sent me. And so it allowed me to kind of get the patients that I want, and transition my practice a little bit at a time. Like, do I still do traditional? Yeah, I still do surgery. I still deliver babies. I haven't thrown the baby out with the bathwater. I've just made my practice more enjoyable for myself, more enjoyable for my patients, because I'm getting results that I wasn't getting before. And that makes me happy.
I think we'll end it with that.
Perfect.
Thank you so much.
You're welcome.